20.
And I also have my roll call sheet, Susan, for what we do action things.
Okay. Call the August 3rd, 2020 meeting of the Health Committee to order. We have all members present, so we obviously have a quorum then. We have minutes to approve from July 6th from our regular meeting. Do I have a motion? Motion by Chung, second by Robustelli. Are there any additions or corrections? Hearing none, all in favor. Do we have to do a roll call on this too, Ms. Morlock?
Yes, we do, Chairman Schaefer, yes.
Okay, thank you. So then I guess would Ms. Morlock, would you like to call the roll, please?
Robustelli,
Yes.
Member Gordon? Member Gordon?
Yes.
Thank you. Member Went?
Yes.
Member Martin? Member Martin? Yes, yes. I
Yes,
saw.
can you hear me?
Yeah, now I can.
All right.
Member Metzger?
Yes.
Thank you. Member Chung
Yes.
and Chairman Schaefer.
Yes. Do we have any members of the public?
No, ma'am. Do you have
Okay,
any?
thank you. Okay, on to departmental matters. First up is Terry Eden from the nursing home. Everybody should have received the, an email this morning with the monthly report. Would you like to elaborate on that, Terry?
Well, I apologize for the report being so late, but I finally got it to you, so that was good. Thank you for letting me be here today. It's my first one, so I'm a little nervous, so bear with me. You have the monthly report in your packet, but just wanted to highlight a few things. We are allowing family visits now with strict restrictions, but lenient to allow all residents to have a visitor. They're maintaining the 6 feet distance, wearing masks, no more than 2 visitors at a time. We continue to follow the IDPH and CDC guidelines for the visits, and a staff member stays with them the entire visit to monitor compliance for that. And it's proven to be received very well. We've received a lot of compliments from the residents and families, so I'm going to continue to do that. We are doing COVID testing for both the staff and the residents, starting tomorrow and continuing through the week to finish that up. And my first 30 days, I've been very busy getting to know the staff and the residents, addressing residents as well as the staff concerns, reviewing controllable costs and working with my managers to help with that process for a better financial control. And I've been busy learning the staffing processes and developing a team to mentor new employees to have better retention and to eliminate the agency staff that we're currently using. We've also developed an admission team to help to increase admissions. And as I say, just a few things that I've been doing, but if anybody has any questions, I'd be more than happy to answer.
Mr. Robustelli.
Ms. Eden, there's nothing to worry about. With one exception, maybe George Gordon. You have to be careful with him. He could be really, real sharp.
I'm warned.
I appreciate your report. It was very helpful. I wanted to just ask you about a few things and make sure I understand them correctly, particularly around the COVID things that you put in place. If I understood correctly, right now, our standard operating procedure is to test every new client when they come in and they are to quarantine in the facility for 15 days. Is that accurate?
Actually, they test prior to coming and they are in isolation for 14 days.
14 days. Okay, thank you. So they test and then they're isolation for 14 days. And then you mentioned that all the staffing in the nursing home are being tested. And if I read correctly, they're going to be tested every 2 weeks for asymptomatic spread. Is that to avoid the asymptomatic spread?
Correct. Yes, and just as a precautionary measure, that was one of the recommendations that IDPH came out with, to test the staff. Residents, not so much, because they are in place. But
Yeah,
yes.
because the staff could potentially be spreading it. So even if you have the residents, I see. That's great. I'm really glad to hear that.
So
And
we're
who's
sorry.
administering those tests for us?
For our residents, Dr. Perel out of, I believe he's from Leroy, is doing the residents, but our staff is going to the Interstate Center site to be
Okay.
tested.
Okay, and so I know in this committee, we've talked a little bit about this as in terms of the practice. When a staff member goes and gets tested, are they able to report to duty immediately, or how does it work, the delay between when they're tested and when they get their results?
Well, if they're not having any symptoms, they can come on their next shift. But if they have any type of symptoms, we get the results back, supposed to get the results back within 24 hours.
Excellent, excellent. I see. Okay, yeah. So I mean, and again, it's really just a precaution to protect against the asymptomatic spread, which I appreciate. I know we've talked a lot about that. Okay, that's very helpful. Thank you very much.
Anyone else have any questions? I would like you to expound on the revenue from the CARES Act, because we got revenue from the CARES Act. And I just found out about sort of what a little bit about that was today. So if you could do that for us, I think that might be helpful.
Well,
I'd be happy to if you don't
can I
mind.
address, can Camille address that? That was kind of started before my time, but
No problem, Mary. And if I may I speak, Chairman Schaefer? Yes. So I can expound on that a bit. Many long-term care facilities that serve individuals who happen to use Medicaid for their insurance were the first to receive some just relief aid through the CARES Act. And so we didn't have to apply for it. We're grateful for it. It just came in the form of a transfer into our account, and our esteemed treasurer, Becky McNeil, gave us a call and said, you have some funds. So what we are doing at this time is researching any restrictions on use of those dollars, but definitely taking all of the receipts we have for the work that we did to supply, for example, the empty wing of the nursing home in preparation should we ever have an outbreak. We're using all of those expenses and at first applying them to the CARES Act dollars that we received. So again, we're very grateful. We will keep the committee updated on future uses of those CARES Act dollars. But again, it was a welcome surprise. So it was very nice.
It's a positive, so that we don't have to spend our money doing some of these things that we would have to do. So I think it's a really, really good thing. So anyone else have any questions?
That CARES Act, that was the federal government?
Yes, sir.
yes.
Yes.
Well, that's pretty quick. They just deposit right in your account, and there's no restrictions on what you can use it for, huh?
We are researching that, Member Went, and I don't want to just say that there are no restrictions. There certainly likely are, but up until we hear anything differently, we are going to assume that all of those COVID-related expenses that we would not have incurred for supplies, especially during this pandemic, that we will apply to that CARES Act at this time.
Well, I think that's a good idea until you find out for sure from the federal government whether it's restricted, because obviously it's for the Virus Act, but hopefully they'll let you spend it for whatever. All right, thank you.
Thank you. Anybody else have any other questions for Terry? No? Thank you very much.
Thank you.
Next up, we have Adult and Juvenile Detention, Shelley and Jason. You have an item, Shelley has an item for action. It was a request approval of a reclassification of nursing position at adult jail medical. And can I have a motion for that, please? Motion by Robistelli, second by Martin. Shelley, do you want to talk about this?
It was mainly to help draw nurses, make it competitive wage-wise, to help maybe get some more applicants to apply.
Member Robistelli?
I'm very supportive of this because we've been hearing for years about the challenge of recruiting nurses and healthcare professionals, and I can't think of a time more important for us to be as fully staffed as possible. One thing that caught my eye was the 3 vacant positions plus the 1 vacant position that's coming next month in terms of the nursing personnel in the jail. And so how many total FTE do we have for nurses in the jail? Like, what's the total number that we have available to fill if we were able to fill them?
Right now we have 6.4.
So out of 6.4 in a month, if we're not able to hire somebody between now and September, we'll go down to 2.4 nurses for the entire facility.
No, it looks like everybody is staying, but I'm retiring, so that's 1 less. But we are budgeted for 9.25 FTEs.
Oh, okay.
Yes.
So it just seemed like I was very concerned to see that we were understaffed given the circumstances. And so I just wanted to, you can't use agency, is that right? Based on the
Yes.
report?
Yes.
So how quickly do you think, if this, presuming this passes, how quickly do you think you'll be able to hire nurses in the coming weeks?
As soon as we get the applications, we call them and try to set up an interview as soon as we can, but then it can take 4 to 6 weeks for the background check.
Got it. And is this something, this is probably a question for Camille, I forget, is this something that when it comes out of committee it's approved, or does it have to go to the full board?
In this particular situation, Member Robistelli, this type of action has to go to finance, but then after that, it should be good to go. So that's.
So you could
good.
act on this week if we pass it out of this committee and then on Wednesday on finance.
Yes.
Okay, that's great. Yeah, okay, thank you.
Member Metzger?
Do we have any compression issues that we'll have to address?
I would answer ahead of Shelley. She can correct me if I'm wrong. It is possible that we'll have to examine the position that Shelley is vacating through her retirement a bit, Member Metzger, so that we don't have compression. So yes, there could be that, but we're prepared to examine that as we look to post her position soon.
And not just for her position, but are we looking at, if you are raising the minimum salary, how does that impact the current workforce? Because you don't want to have them way down in, if you're increasing that range, you need to make sure they're in the same position of the new range, generally is what happens. So I would think that you would need to look at all current nurses in that facility and make sure that they are not losing ground as within that range of dollars.
Yes, thank you. I didn't express myself properly. We will be examining all positions, that this will be applicable to all, not just the ones we are filling. Yeah.
Thank you. Member Went, did you have a question?
No, I'm just waiting for the vote.
Oh, okay. Anybody else have any other questions about this? Okay, so then, Ms. Morlock, would you call the roll, please, for vote?
Yes, ma'am. Member Robistelli.
Aye.
Member Gordon.
Yes.
Member Went.
Yes.
Member Martin.
Yes.
Thank you. Member Metzger.
Yes.
Member Chung.
Yes.
Chairman Schaefer.
Yes. Thank you.
Thank you.
Thank you.
We have the Adult and Juvenile Detention Center reports. Shelley, did you have anything that you wanted to highlight on your report?
No, ma'am.
If I may though, Chairman Schaefer,
Sure.
I know that, our Sheriff, John Sandage, is here, with us, and I know that as part of his, work, and leadership, obviously, in the detention facility, he wanted to have an opportunity to speak, with Shelley tonight, but him to go first, about the jail. So, if we may, Chairman Schaefer, could, the sheriff have the floor?
Go
Thank
right ahead.
Thank you. I just wanted to relay some information. We do have 3 positive inmates now at the jail, mild symptoms. We also have 2 staff members that are positive, also with mild symptoms. And I just can't say enough about the medical staff and the correctional staff and the job they've done to this point, as far as keeping things clean, keeping people healthy, and keeping the virus out of the facility for as long as we have. We all knew that eventually we would probably get a case, but to limit it the way we have has been great. Shelley's been a huge help. We appreciate all of her help. All of the inmates and staff that have tested negative will be tested every 5 days until there are no further positive cases in the jail. So we will continue the testing until we know that we have a completely clean facility. And I'd be happy to answer any questions if I can, or if I can, I'm sure Shelley can.
I think Member Metzger had a question earlier, or was that something different?
Actually, he's answered those questions, so I am good. Thank you.
Member Went?
Yes, Sheriff, I know you're doing a good job. Now, the ones that have the virus, are they the ones that should have been sent off to the state penitentiaries, or
We've got one that should have been in the Illinois Department of Corrections. We just got a ruling in that lawsuit today against Governor Pritzker. Judge ruled that he did not have the authority not to accept inmates. Therefore, those transfers will begin. The other 2, one has been convicted and not sentenced, and the other one is awaiting trial.
Okay, the one that's convicted, waiting sentence, as soon as he is sentenced, then he'll be sent on to the state prison.
Correct.
Well, thank you very much for filing that lawsuit, because I think the governor was out of order when he did it, and I guess the courts agreed with you. So thank you very much, Sheriff. Doing a good job.
Thank you.
Member Obestelli?
Thanks for the information, both Shelley and the sheriff. I'm glad to hear that we're going to do the testing every 5 days, because I think that would be really helpful in identifying and mitigating and the spread. I just wonder, after we get to a point where the tests all come back negative, will we incorporate some of the same protocols that the nursing home is actually we just learned about, which is everybody that comes into the jail will be tested, quarantined for 14 days, and then be placed in the general population. And the staff that are moving around in the jail will be tested on some cycle going forward. I just wondered if your standard operating procedures will change after, and hopefully soon, we get out of the current crisis of COVID cases.
I haven't looked at what the nursing home's doing. As far as testing all new inmates that come in, that I mean, we could be talking 30 inmates a day sometimes. And I right now, what we do when a new inmate comes in, they are quarantined for 14 days before they're released into general population. So at this point, they've only been tested if they exhibit symptoms. We would have to look at like I said, I don't know specifically what the nursing home is doing, so I'd have to take a look at that. But that could be very manpower intensive to do that on some.
Well, I know that I don't know how that would work, but I would just say I think if with the sort of spread of this in terms of asymptomatic spread, it may be a necessary evil for us in terms of trying to test it, because if we have as many as 30 people coming in to the facility and they're all in the booking area, I assume that we're not able to isolate people completely from new people coming in. So even that 14-day window is very difficult, because if one new person comes in on day 13, they're exposed. So the only way to really know if the people in that population are not positive is for them to be tested. So I just would say, I hope that, I mean, if it's a budgetary consideration, I just hope that you'll feel comfortable, Sheriff, coming back to the Justice Committee or the Finance Committee and asking for what that includes, because I think, like you said, the spread of the virus, because of how contagious it is, was inevitable. So if there's a way for us to incorporate standard operating procedures, both on the intake and then with the correction officers that are in the facility, I think that gives us the best chance at protecting everybody who's in a confined space.
Yeah, and I'm not opposed whatsoever. I just got an email probably 5 minutes ago from CDC on some new ideas and guidelines for correctional facilities. I have not had a chance to read it yet. I did forward it on to Shelley, so we'll talk about it. And like I said, I'm not opposed. It's just a logistics thing.
Plus, we're working really closely with the health department. Melissa and I have gotten to be really good friends from all of this. So when we get to the point that we have all the negatives, we're going to depend on them to give us guidance on what to do next. So hopefully that'll come soon.
Member Metzger?
I do see that we have 7 pregnant inmates. So is there something special being done with those inmates who are pregnant?
We don't have 7. That's probably the yearly total. We
have 1. I'm sorry.
We have 1, yes. And she was tested just like everybody else.
And she's not being isolated or anything like that?
They're all isolated right now. Everybody's isolated.
Anybody else have any questions? Member Chung?
Yes, thank you, Madam Chair. I guess I also have a question about the sort of guidelines and procedures for the staff at the facility, about them wearing PPEs. Are they supposed to be wearing masks all the time when they're in contact with the inmates and the population? Because there have been some reports that I've heard from people that I've actually spoken to that have seen people and staff at the detention facility without PPE. So I'm just wondering if that's being enforced. Thank you.
I'd be curious to know where you heard that from, because we are very diligent in doing that. I have had no complaints whatsoever to myself or the facility of that. There is a lot of misinformation out there right now about what's going on in the facility and measures being taken. So I'd be happy to hear any of those complaints, but I must say all of our staff has done an excellent job with their PPE and limiting exposure.
Okay, thank you.
Any other questions? Member Robustelli?
Just to follow up, just to make sure, do you feel comfortable, Shelley and Sheriff, in terms of the supply of PPE, the masks, all the things that are necessary for you, the staff and inmates? I know in April there was a challenge there. We were having to reuse some things, and I just wonder if you can give us an update on your supply chain.
From my standpoint, we're doing fine on it. Of course, you can get it. It's probably 3 times the cost of what it was initially. Emergency management has been excellent in assisting us in getting things. Shelley, you have anything to add on that?
Being frugal as I am, I shop around and I've gotten some pretty good deals on masks. And I think I just ordered about 1,000 more because we do provide for the inmates and the nursing staff. So, yeah, we're really good on PPE right now.
Member Went?
Well, Sheriff, it's a good thing that we haven't defunded you. It sounds to me like you need extra money, and if you do, get a hold of the Finance Committee because we should fund you to the maximum. Thank you very much.
Thank you.
Any other questions for Shelley or the sheriff? Okay, any questions for Jason on the juvenile detention report? And I guess maybe, and if Jason, if you could explain some of the things that you're doing also along with what the sheriff has just said, and what Shelley said about precautions that you're taking at JDC.
We're doing exactly the same thing they're doing. Quarantining, coming in the door for 14 days, all staff, PPEs. We're not having a problem. Department of Juvenile Justice just allowed us 500 more masks. They said those are available anytime we need them. Kids are wearing them until they're done with quarantine. If they choose to continue to wear them, we're allowing it. A lot of hand washing, a lot of cleaning of everything, everywhere, all day, every day. We have not had to test anyone yet. We have not had anyone show signs or symptoms. So once that does occur, we'll need provisions for that. But other than that, we have everything we need.
Thank you. Does anyone else have any questions for Jason? Member Metzger?
I just am curious on the education, how that is going to be handled, because I know you have someone that generally comes in. Is it going to continue to be that, or are we doing online?
We are currently on our summer break. She taught through the initial part of the pandemic. She will be returning, and she'll go through the same regiment that all staff do coming in and out of the building. So she will be on site.
Member Robustelli.
Are you thinking about or considering or have already done surveillance testing in terms of your employees that are coming in and out of the facility? Are they on any schedule for testing? Is it recommended that they get tested?
They've been made aware of where and how, but I don't know of any individuals that have gone. They may have done it on their own, but we're not requiring it this time unless they show signs or symptoms coming through.
And so are those in the facility able to have visitors, in-person visitors?
We are doing non-contact visiting right now by schedule. The parents are scheduling their visits, and then we're cleaning everything between each visit in the non-contact visiting area.
Okay.
Any other questions? Thank you. Thank you, Shelley, for that information. And I think the sheriff is off now, but thank Sheriff Sandage for that information also.
You're welcome.
Next up, we have Jessica Mcknight, Health Department Administrator.
Hi, you guys have my report in your packet, and just wanted to give you an additional update about some things we've been working on. So we've been interviewing for grant personnel through our contact tracing grant. So I'll be bringing an FTE amendment to stand up. We also are getting ready to purchase through IT technology, again, for the grant personnel that are going to be working on the contact tracing grant.
Any questions from the committee? Member Robustelli.
Jessica, so I wanted to follow up I appreciate the information you provided in response to the questions that I had asked last meeting and we exchanged by email. I wonder if you've gotten any updates from the testing provider in terms of their ability to share information with the health department.
I have not had any updates since I was told that the question will be forwarded on to the CEO of the company.
Do you know at this point who they share that data with?
I do not, other than what is needed for the third party calling center.
Okay. And I saw in the news that there were, not just in McLean County, but across the service area for which they were providing these testing, there had been some delays and issues with some of the people being tested. Do you have a sense at this point how many people in McLean County that may have impacted?
I do not. Backlogged labs are a nationwide problem right now, I know. So I don't know exactly the number in McLean County through this testing site, but even statewide, other labs are having, issues with turnaround times just because of the amount of testing that is going on right now.
There's also something that I've seen going around on social media and just in terms of conversation, allegations that people who have not been tested are being contacted and told that they are positive for COVID. Have you or the department received any reports of that kind? Is there any validity to those claims?
I don't believe we have, but we've cautioned the public before, to be leery of calls that they get from people. We will always identify ourselves as the health department. So if you get a call from us, we will always identify ourselves.
Okay. And so you and the EMA are continuing to help those that aren't able to get their testing results in a timely manner get those results. Is that still the practice that we're following?
EMA might be at this time. Right now, we are referring people back to Redditus, really so that they're aware of what's going on and can go right to the source.
Okay. And then my last question is related to the conversation we just had with Shelley and the sheriff regarding standard operating procedure and best practices going forward. It sounded to me like Shelley is going to rely on you for guidance in terms of whether or not to test all inmates coming into the facility to control for asymptomatic spread. So I wondered if you have a sense of what kind of guidance you plan on giving at this time to them.
So, Shelley, like she mentioned, has been working very closely with Melissa down in our communicable disease department. So, between Melissa, Illinois Department of Public Health, we'll have to look at, for right now, they're going to be doing the every, I think, 5 days until there are no positive cases. And then we will go from there.
Well, I would just say the same thing. I think I don't see a way to control for asymptomatic spread unless every person that's coming in, when there's community spread throughout the community, which you've talked really, I think, aggressively about, and I'm appreciative of that because I think people need to understand that it's actively being transmitted throughout McLean County and throughout Central Illinois. I think if we don't test people when they come in, we are just going to open ourselves up to having to do this 5-day thing again, or for as long as this thing is out there. So I hope that you guys will seriously consider advising the jail to do that. And if there are resources that are needed, I'd like to hear what that would entail.
And we will also always.
I'm sorry. Can I please get you to stop for just a moment because our system here in the room is restarting. And
yeah, it says that actually.
Yeah, and so I've got them to turn it on here so that I could continue to record with my little recorder, and luckily it usually records on the GoToMeeting too. But if you could just hold on a moment while we figure out what's going on. I just don't.
That says the meeting's going to end in 5 minutes, so let's move it along.
I'll do the best I can.
Stop that and bring
Yeah.
it in.
It's working in there?
Yeah.
Okay, just one moment.
Yeah, because when Camille went into 400, it worked, she was on the screen. Yeah, I was gonna ask you if she had a question.
If I may, Chairman Schaefer, I've just asked Ms. Morlock to bring her recording device into the county boardroom, and then we should be able to get back into business here very shortly. She just needs to plug in and press the button. So here she is, and she will do that. Thank you. No, it's not
Technology's
anyone's
great,
fault. I
but
don't,
technology's
technology
a problem.
does what technology does, so. Thank you, everyone. Okay, we're ready. Go ahead. Sorry, Ms. McKnight as well. I know you were in the middle of something, so our apologies.
I don't know where I was. I was just making a plea that I think the more aggressive, the more conservative we can be about monitoring asymptomatic spread and testing for it, the better off we will be in terms of monitoring and controlling where it is in a confined space. Everything we know about this virus is in confined spaces, it spreads like wildfire. And the only way to prevent that is to prevent it from coming in. And there are two entry points, the intake and our employees. So I think what the nursing home is doing is a model, and we should follow that model right into our adult detention center. I think that would be the best practice, and we still may end up with cases, but that would be the best possible practice that we could follow. So I think that's all I had. The last thing I wanted to ask Jessica was, I know I think we have 8 consecutive days within our region of positive COVID marks, which is one of the metrics that the governor has set in the new sub-regionalization plan that he's put forward. I wonder at what point will you take locally, are we going to default to the IDPH, or are there triggers that you and your staff are looking at in terms of making recommendations to the mayors and to the county board between now and when the IDPH would make those decisions? For example, recommendations around bars or other kinds of high spread business and facilities.
So in addition to the regional metrics that are the 8 days, I believe our region, so Region 2, has had maybe 7 or 8 days consecutive of increases in the positivity rate. But I'm also looking at our county-wide metrics. So positivity rate right now, we've been hovering right around or right below 2%, which is a good sign. So I'm really looking at that as well as our region. Hospital metrics, definitely looking at that as well. So, across our state, we've seen a slight increase in hospitalizations, but we're still not seeing like we were, back a couple months. So those are the things that I'm looking at, is more locally. Illinois Department of Public Health today on our call was talking about what they will do before they announce that warning. So that locally we would get kind of an update, and they would look to have even a regional call if our entire region was going to be under a warning, so that we can look at the mitigation strategies as a region and go forward before, again, anything would be announced, before we'd go public. So really, I'm keeping an eye on it, but at this time, it's a lot about personal responsibility, encouraging people to care for their neighbors and do those things that we know that'll help us control this.
Thanks.
I also want to add that there have been Board of Health members that have been discussing it amongst ourselves before our next board meeting as to things that we might want to be looking at and potentially recommending moving forward. So we are already doing that, but our meeting isn't till next week. So that that is also going on at this point in time. Member Chung, did you have a question?
Yes, I did. Thank you. I just also want to echo a lot of the things that Member Robustelli has brought up about being more proactive, I guess, about trying to test staff in the jail and the detention facility. To me, I feel like, you know, if there's a way that we can kind of just try and prevent it coming in from whatever, you know, these points of entry, as he said, I think that to me, this just seems like, honestly, a no-brainer. So if there's any way that we can try and do this, I would really encourage it as much as possible. And I do know, I guess I also wanted to ask Ms. McKnight, back, let's see, I guess this was back in the spring. I do know that there were a lot of calls between the universities and the what am I trying to say? The health department to try and talk about this. Has that been ongoing, or is it going to start up again now that, you know, possibly a whole bunch of college students are going to be coming back into town here soon? I was just wondering what our plans were regarding that. Thank you.
So we've been talking with ISU most recently, just looking at mainly contact tracing, and so talking to student health services, and really trying to plan ahead about how we can partner together.
Are they going to have their own contact tracers that are not health department and yes, working together, but how would that work if they have their own contact tracers and we have our contact tracers for every place else? And the same thing goes for Illinois Wesleyan. I don't know what their plans are, or Heartland or whatever. But because the students are part of the overall community, how is that going to work if they're separate than what we're doing?
So in talks with ISU, we're looking at, again, everything is still being put together, but, you know, we're looking at those contact tracers still being part of our employees that were just personnel through this grant. All positive labs will come through the health department, whether, you know, would that be our contact tracing staff that we have now, or the contact tracing staff, the case investigators that we're hiring through this grant. So, you know, we look to sometimes and partner with employers to do contact tracing, but the full case investigation is something that the health department will still be doing.
Member Gordon.
Thank you, Madam Chairman. I got a few questions that I'd like to address to Ms. McKnight. One of them has to do with something that Member Robustelli referred to earlier, as far as turnaround time on the testing results. We have all heard, I am sure, about delays in the testing results. How much and in what ways does that complicate your life and that of the health department, Ms. McKnight, in terms of contact tracing, if the results are delayed in some cases for more than just a few days?
So I spoke to you before. What we've seen on average is our positive results still coming through us in a timely manner. So that definitely helps, because we want to get that positive individual contacted as soon as possible. So, you know, that is what we have been seeing as a trend, is that those positive results are still getting reported in a timely manner.
Okay, I appreciate that. I guess I have concerns about the testing, the turnaround, and the contact tracing when you add 20,000 people to the mix, which the universities coming back will certainly do. And I know you have those same concerns and then some. My other question is a little more of a mini practical question. I know that there is a procedure in place, or there are procedures in place for the health department to receive notifications of violations. In particular, in places of business where the people on the staff aren't all wearing masks, or maybe not all wearing masks properly. What could an individual do? It's a bit awkward, but it might be useful. What can an individual do to get in touch with the health department to let you know that a business might need to be at least apprised of what the expectations are under existing state procedures?
Sure. So our environmental health department is taking all of those complaints and following up on any of them that we receive. And so they can either be reached by, if an individual calls in at 309-888-5482, or we also do have an email that comes just into the health department with general questions, health@mcleancountyil.gov. So that's how we receive most of our complaints that are coming into us.
And you indicated that the health department does follow up with those. You have said in the public media that there's an effort at persuasion, and I've seen indications that those efforts have been largely successful, that people have been, business owners have been responsive. Has the health department had any difficulty keeping up with those follow-ups?
Not to this point. Again, we've answered, I think we've responded to over 240 complaints since March. So, you know, that's definitely a lot. But like you said, largely we are getting voluntary compliance. We have not had to issue any cease and desist orders at this time.
Does the health department, does the county health department have that authority to issue such orders?
That is something we can seek if necessary.
But you haven't had to, and that's good to know. Thank you very much.
Thank you. Can you, Jessica, could you talk about your remote that you just did recently and how that went over? I mean, I know that there was articles in the paper, but there's some people that don't read the paper or whatever. Can you elaborate on how that went, and if you learned anything, if things should be different the next time you go out? And because I know you have a whole schedule of dates and locations, and what kind of reception that you got on that?
Yeah, we've had a really great reception. Only had 2 sites so far. So Colfax, we did 34 tests, and then Leroy last week we did 71 tests, and got all of those results quickly, which is good, through a portal system, and we're able to contact all those individuals quickly. Again, reception has been good, and of course, yes, a learning curve. A lot of the learning things we've learned have been more about logistics, about just setup and proper what works better and what would be more timely even. So things that we could do potentially to cut off the time at registration or, specimen collection.
Thank you. Anyone else have any questions for Ms. Mcknight? Okay, thank you very much. Next up is Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer. The only thing I have today is our report on recent employment activities. You can find that on page 52. I clearly collaborate extensively with Ms. Welch, Mr. Tabb, Ms. Mcknight. So they've given such extensive reports that I don't really feel I need to expound, although I would be happy also to answer any questions. So about the report or anything.
Anyone have any questions for the County Administrator? Anyone else have any other business or communication? Member Gordon.
Thank you, Madam Chairman. I just wanted to thank Member Robustelli. I'm going to double his salary as my public relations man for his comments earlier to ingratiate himself, or I don't know for what purpose, but I'd be really interested to know what is in Ms. Eden's mind right now. I'm not going to ask. Thank you, Carlo.
Okay. Since there's nothing else, our next meeting is August 31st, which means today is August 3rd, and the next meeting is August 31st because that is the September meeting. So I just want to make sure that everybody knows that even though the next meeting's August 31st, it's actually our September meeting because of Labor Day. So we have bills to pay. A nursing home has a prepaid total of $232,439.65. Motion by Chung, second by Metzger. All in favor? Or do we have to do a roll call vote for each one of these two, Ms. Morlock?
Yep.
Ms. Morlock, would you please call the roll?
You'd have to, I think you have to come over here. You can take my spot. Not a worry.
I apologize. Member Robustelli,
Yes.
Member Gordon,
Yes.
Member Went,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Chairman Schaefer.
Yes.
Chairman Schaefer, might
the-
I suggest, and we might check with Samantha in the other room, I'm wondering if you could list the, where you could say the next three bills and the amounts, and then we could just take one roll call vote on all three of those. I'm not sure if Samantha would tell us if that's okay or not. But I wouldn't know why,
Okay.
because we'd be saying
That's a good idea.
all three of them and listing them. Here comes
Yeah, I
Samantha.
can say what the totals were. Yeah, okay. All right. The next three are the Developmental Disabilities Board has a prepaid total of $56,501.18. Jail and JD Medical has a prepaid total of $49,402.12. And the Board of Health has a prepaid total of $240,645.80. I have a motion for all three of those.
I'll move that.
Member Went, second by Member Metzger.
Madam Chairman, a point of order.
Yes, yes, sir.
I don't know that we got an opinion on that, and I guess I'm curious to know whether that is recommended procedure and, more to the point, permissible procedure.
That's what I was waiting. Samantha came up, but I don't see her speaker on. I was going to ask her, Mr. Gordon, just before I did that, because I don't want to.
May I direct that question to Samantha, Madam Chairman?
Yes,
That's fine.
it's fine to do that way.
Can everyone hear me? Okay. My suggestion on these is always safest to do them separately. And especially if we can just go through with Julie to do the roll call for everybody.
I was suspecting that that's what she was going to say. So, okay. So back to the beginning. Developmental Disabilities Board has a prepaid total of $56,501.18. Motion by Metzger, second by Gordon. Morlock.
Robustelli?
Yeah.
I'm sorry. Okay, thank you. Sorry. Gordon?
Yes.
Went?
Yes.
Martin?
Yes.
Metzger?
Yes.
Chung?
Yes.
Schaefer?
Yes. Jail and JDC Medical has a prepaid total of $49,402.12. Motion by Martin, second by Chung. Ms. Morlock.
Mr. Robustelli?
Yes.
Mr. Gordon?
Yes.
Mr. Went? Mr. Went?
Yes.
Okay, thank you. Mr. Martin?
Yes.
Ms. Metzger?
Yes.
Ms. Chung?
Yes.
Ms. Schaefer?
Yes. Thank you. Bills have been paid. And so if there's nothing else, then I believe this meeting will be adjourned. Thank you all.
Thank you.
Uh,
Bye.